select two types of filler for her. So let's talk about what we see and why we're going to use one filler for one area and we're going to use a different filler for another area. So for her temples and for this area right here, which I would call her mid-face, she is actually seeing flattening or depression. She's actually losing some volume. This is a natural process that happens with aging, and we can actually re-volumize these areas to give the necessary volume replacement to give the desired effect. So we're going to use Voluma on those areas, and then as we go closer to what's known as her tear trough, this is where if she had a tear, it would just fall along this fault line basically. And we can actually use a specific filler to replace volume here in the tear trough itself. And so for that, we're going to actually use a product called Volbella. We've had a little bit of topical numbing that we've placed on her skin ahead of time. So it's a little bit more comfortable. We like to use ice in this practice because ice is a great anesthetic. And then the product itself has anesthetic in there too. So by increasing the volume where she's getting some flattening here, we're going to actually improve part of the tear trough itself, but then we're going to directly go in and replace in the tear trough. But it's funny how when you look at facial anatomy, when you start to replace some volume deficit in one area, you can get an improvement in an adjacent area because now you're getting rotation of tissue back into place. It looks good. And we're going to use just one syringe of each today, but depending on a person's age, you really can see the need for even as much as 4 to 6 syringes of various products depending on where their loss is and also, of course, their age, their level of volume loss. Tara's in her 30s, so it kind of makes sense when you have somebody in their 30s, usually you're going to use at least 2 to 3 syringes to replace volume loss. So I think we're there when it comes to her cheeks, but now we're going to use the rest of this product to give a subtle improvement in her temples. And although she's having a needle injected into the skin, she's really not feeling so much pain as she is in this area. It's more about a pressure sensation, which is kind of odd in that it's so close to the eye, but it really doesn't feel painful, especially when you put a little bit of the topical numbing on ahead of time and use ice prior to the injection.
It feels like a tingle.
A tingle. I think this procedure using injection of a filler to achieve fullness in the tear trough that's been lost is probably a really, really instant hit with most people in terms of seeing dramatic improvement from, you can see from one side to the other how that looks. So now we're going to go back and on her left we're going to do the same thing. But it's a really dramatic difference for what would be considered a small amount of financial output to achieve that look. So Amanda, will you massage?
Okay guys, so I'm immediately post-filler. I had 2 syringes of Voluma divided between my cheek and my temples, and then I had a Volbella right into my tear trough. So right now, immediately post-procedure, I don't really have to do anything except for ice, which I'm totally happy to do. I've already received a massage from Diana that was actually amazing and felt really good. She prepped the skin post-procedure with a little bit of HA5, so I'm gonna get that instant gratification, a little bit of rehydration to the skin, and then she put on Color Science. So I am ready to go, get back to work.